I'm making this video to give you a little more clarification on these terms than is what's simply written on the page, because they can be a little confusing. So the first thing you got to know when you find your partner or you're looking in the mirror to do this exercise is you have to assume the anatomical position. This is the best way to see it. Legs slightly apart, toes facing forward, palms open and out. So your thumbs are out, your elbows are a little closer to your body than your hands are. Okay, head straight up. This is the same anatomical position from the side view. Okay, so all of these terms are relative only within this anatomical position. So let's start with the first two, superior and inferior. Superior means up, inferior means down. Superior up, inferior down. And again, whenever you're talking about, when you're writing these sentences that you're going to have to do, you can't just say Bob's hair is superior. You have to say Bob's hair is superior to his waist. That means it's above his waist. You have to have a point of reference when you're doing this, okay? So superior, inferior. Anterior, posterior. Well, posterior is a slang for the back side, right? So anterior is towards the front, posterior towards the back. Okay, so you kind of need a side view in order to do this. So Bob's butt is posterior to his belly button, right? And his chest, you got to be careful with chest. Chest is kind of big. Let's say his nipples are anterior to his shoulder blades. Okay, they're in the front position. Medial and lateral. That's why we need this one right here. So medial and lateral. So the midline of creatures in anatomical orientation is right through the center of the body, right through the nose, right through the navel. Okay, so that's the midline. Now, medial and lateral are relative to that midline. Lateral is on the outside, moving out more lateral, and medial is moving toward the midline. Lateral moving out, medial moving in. Okay, so we can say Sarah here, her elbow is lateral to her navel, right? Or we can say her breast is medial to her shoulder. Make sense? All right, now we have cranial towards the head and caudal. So in this, it goes in a sort of S-shaped pattern, sort of following the spinal cord. Here's the tail. Caudal in Latin means tail. And here's the cranium. Okay, so cranial. So we kind of ignore the lower half of the body on these two right here. Cranial is towards the cranium, and caudal is towards the tail. Okay? Now, the only difference with this is when we are inside the head. When we're inside the cranium, it doesn't make sense. Say we want to talk about an area of the brain right here relative to an area of the brain right here. It doesn't make sense to say this one is cranial to this one when they're both in the cranium. So in this case, we use the word rostral. Okay? And again, it's this sort of curved shape. Here's your spinal cord, and we say the frontal lobe is rostral to the occipital lobe over here. Okay? Caudal still goes this way, rostral that way. So this one's a little confusing. Cranial and rostral sort of mean the same thing, except cranial when we're talking about the entire body, and rostral when we're actually in the head. Okay? And then we have dorsal and ventral. Dorsal is backside, ventral is belly side. Notice dorsal and ventral in a four-legged animal are the same as superior and inferior. But dorsal and ventral in a two-legged creature is the same as posterior and anterior. That's why we have to learn the difference between the two. Central and peripheral, this has to do with specific organs, what's in the center of the organ as compared to what's on the outside. Superficial and deep, this also doesn't really apply to the anatomical position. This is, think of a surgical procedure, what is on the surface of your forearm and what is deep in your forearm. So your belly button would be superficial, your small intestines would be deep, right? And then we have proximal and distal. Proximal and distal are used the exact same way that medial and lateral are used. Okay, so again, central to the midline. Anything that is proximal is in the direction of the midline. Anything is distal is away. So Sarah's thumb is distal relative to her knee. Okay, her pinky is medial relative to her thumb. All right, and finally the last one, ipsilateral and contralateral. Ipsilateral means same side of the body. So Sarah's right shoulder is ipsilateral to her right foot. Sarah's right shoulder is contralateral to her left foot. So you really almost have to use right and left in this. Anyway, I hope that clears up the terms.